Hey there, and welcome. If you've recently been told you have gestational diabetes, I know you've got a lot on your mind, but you're in exactly the right place. In this explainer, we're going to break down everything you need to know about managing your diet, and we're using guidance straight from Dr. Praveen Ramachandra, a senior endocrinologist at the Diaplus Endocrinology Clinic right in Bengaluru. So let's make this clear and simple.
Okay, so you get a diagnosis like gestational diabetes or GDM, and suddenly it feels like everything is overwhelming. There's so much to learn, and it's totally normal to feel a little stressed out. But what if I told you there's one single, super simple rule that changes the whole game? Seriously, stick with me, because that one powerful idea is what this is all about.
So let's quickly talk about what's actually going on inside your body. It's pretty amazing, actually. As your pregnancy moves along, a whole cocktail of hormones, like HPL and cortisol, start to surge. Now, their main job is to help your baby grow, but they have a side effect. They kind of make your body ignore insulin. This is called insulin resistance, and it just means it's tougher for your body to keep blood sugar levels in a happy, stable place. And that's the challenge we're here to solve.
All right, so to deal with that insulin resistance, we need a really smart strategy. And lucky for us, there is one. We're calling it the golden rule of GDM. It's a simple idea that's going to be the foundation for everything you eat from here on out. And here it is, the rule of pairs. It's as easy as it sounds. You should never ever eat a carbohydrate all by itself. So whether it's a piece of fruit, a roti, some rice, you always have to pair it with some protein or some healthy fat. Why? Because that protein or fat acts like a speed bump. It slows down how fast the sugar from the carb hits your bloodstream, and that prevents those big, nasty blood sugar spikes we want to avoid.
And you can just see the difference here. It's incredible. On the left, you eat an apple all by itself. We call that a naked carb, and whoosh, your blood sugar shoots right up. But look at the right. That same apple, but this time paired with a few almonds, gives you this beautiful, gentle, stable blood sugar curve. This right here is the rule of pairs in action, and as Dr. Ramachandra tells his patients, this is probably the most powerful tool you have.
Okay, so the theory makes sense, right? But what does this look like in your actual kitchen, on your actual plate? Let's get practical and bring this rule to life with some real food.
Here we go. Some really easy, tangible examples. Instead of just grabbing an apple, grab a small handful of almonds to go with it. Having a Ragi dosa, which is a staple in Bengaluru where Dr. Ramachandra is based, pair it with a simple boiled egg. That bowl of brown rice, make sure it has a thick, protein-rich dal or rajma right alongside it. You see, it's not about taking food away, it's all about pairing it up smartly. And for your big meals, lunch and dinner, this is your blueprint. Just picture your plate. You're going to fill half of it, with non-starchy veggies like greens, beans, carrots. Then, a quarter of the plate is for your lean protein, and that last quarter is for a good, high-fiber carb. And then you just add a little healthy fat, like some nuts or a touch of ghee. This simple visual makes building a perfect meal so easy. Now that rule of pairs is your constant. It's always there. But your body and your baby's needs, they're not constant. They change. So let's talk about how you'll need to adapt your diet a little bit as you move through each trimester. You know, it's really important to understand this part because it can feel like managing your blood sugar gets harder as you go, and you're not imagining it. In the first trimester, that insulin resistance is pretty mild, but by the second, and especially the third trimester, those hormones are at their peak, and that means insulin resistance is at its highest. Just knowing this helps you stay patient with yourself and on top of your game. And of course, your baby's needs are changing too. In the first trimester, believe it or not, you don't need any extra calories, but you do need to focus on folic acid for that crucial brain and spine development. Then, come the second trimester, you'll add about 340 calories a day with a focus on iron and calcium for blood and bones. And by the third, it's up to about 450 extra calories, with things like DHA for brain growth and lots of fiber becoming super important.
Okay, deep breath. I know that's a lot of information. So let's just boil it all down into your GDM master plan. We're going to focus on the few critical can't forget numbers.
First up, let's look at the big picture of your diet. I want you to notice something right away. This is not a no-carb diet. It's not even a low-carb diet. It's all about balance. We're aiming for about 40% of your calories to come from good, high-fiber carbs, 25% from protein, and about 35% from healthy fats. Getting this proportion right is just key for steady energy and blood sugar.
Now, if you only remember one number from this whole thing, please make it this one, 175 grams.
That is your absolute minimum, your daily floor for carbohydrates. This is non-negotiable. Dr. Ramachandra is very clear on this. Why? Because your baby's growing brain needs that glucose to develop properly. Going too low is dangerous and can lead to a state called ketosis, which we absolutely want to avoid.
So here it is, your whole GDM checklist, nice and simple. Number 1, always follow the rule of pairs. 2, keep that blood sugar steady by eating 3 meals and 2 or 3 snacks every day. 3, never ever dip below that 175-gram carb floor. 4, use that balanced plate formula as your guide for every single meal. And 5, just remember to tweak things a bit as you move through the trimesters. That's it.
And I want to leave you with this really powerful thought from Dr. Praveen Ramachandra. This whole journey isn't about restriction. It's not about all the things you can't have. It's about shifting your mindset. It's about smart pairing for a healthy you and for a thriving baby.
So, my question for you is, what's the first paired snack you're going to try today, right now? Is it going to be that apple with almonds, some curd with walnuts? Whatever it is, take what you just learned and put it into action with your very next snack. You can totally do this.